Ethiopia is a country of great antiquity, with a culture and traditions dating back more than 3,000 years. It's also a country embracing the changes, conveniences, and advances of contemporary times, especially those that improve the quality of life and can even save lives. Saving lives is a priority in a country with high maternal mortality. In Ethiopia, approximately 14,000 women die each year of maternal causes. The leading causes of maternal mortality and debilitating pregnancy complications are unsafe abortion, hemorrhage, and obstructed labor. The delivery of family planning services is one of the most important strategies for reducing maternal mortality and morbidity. Globally, an estimated 1/3 of maternal deaths can be prevented through family planning, as every pregnancy poses health risks. Nevertheless, less than 1/3 of married women use family planning in Ethiopia. The result is a large number of unintended pregnancies every year. In an effort to address these challenges, EngenderHealth, in collaboration with the Ministry of Health, has been implementing a 3-year project called Access to Better Reproductive Health Initiative, ABRI, to enhance comprehensive contraception and abortion care services, with special attention paid to increasing access to long-acting and permanent methods of contraception. The project is currently operating in 174 government facilities in 5 regions: Amhara, Oromia, the Southern Nations Nationalities and Peoples Region, Harari and Benishangul, and 2 city administrations, Addis Ababa and Dirredawa. EngenderHealth's formative research prior to launching ABRI indicated that a number of factors have hindered access to long-acting and permanent methods of contraception and to safe abortion services in Ethiopia. These include a lack of accurate information about available contraceptive methods and services, poor infrastructure at clinics and health facilities, including inadequate commodities and supplies, as well as a shortage of skilled professionals able to provide high-quality reproductive health care. Since ABRI was launched in 2008, EngenderHealth has made great strides in addressing each of these matters and expanding access to long-acting and permanent contraceptives and safe abortion. We are documenting best practices that can be replicated and scaled up in partnership with the Ministry of Health, additional service providers, health facility managers, partners, and donors. Here, those involved in and benefiting from the transformations explain the progress being made at health facilities and in communities alike. The training provided by EngenderHealth addresses services at a number of levels, from skills improvement among health workers in both surgical techniques and client communication, to better management and supervision throughout the health system. All of this adds up to better services where clients feel comfortable seeking care and are treated with respect. My name is Sister Birzaf Gabru. I am the head of Addis Katama Health Office, where we're focused on prevention initiatives. EngenderHealth has been making meaningful contributions in the area of mother and child health and helping the government implement health policies. From them, we learned facilitative supervision. Everyone from the higher officials at the facilities to the officers at the subsidy level is involved. They assess their supervision capacity, identify the gaps, and then design tailor-made training kits. Prior to this, our traditional supervision model focused mainly on finding faults rather than the root causes of problems. This, of course, wasn't helpful to the service providers, and as a result, no changes were observed in the quality of service delivery. Now, supervision teams were formed to visit selected health facilities on a regularly scheduled and ongoing basis, providing feedback and, if needed, further training each time. The quality of services has significantly improved as a result.
Our objective is to provide surgical family planning services to both women and men. We use both theoretical and practical methods for training, and we are able to offer very engaging trainings that cover a wide range of real-life scenarios using a lot of role plays. This is especially valuable for the counseling training. By the time the trainees are back at their health centers, they are already very comfortable and proficient. For the practical trainings, we have lifelike models that we use first, before observing and performing real procedures. Because trainees are prepared, they are able to learn new procedures quite easily. In brief, I would say that the training programs have been very successful.
My name is Sister Tsege Wibalam. I work in the Family Planning Unit of the Soto Health Center. I am a graduate of Gondar University and have been working here for the past 10 years. The family planning services we provide here have improved dramatically in recent times due to the invaluable training we have received from EngenderHealth in long-acting family planning. It was unlike any other training we've had before. In addition to being comprehensive, there was also a strong supportive follow-up component. By linking my prior training in comprehensive abortion care with family planning services, I can now give the best possible care to the clients. The fact that we offer a range of family planning methods and services makes it easy for clients to make voluntary informed choices on what works best for them. My name is Sister Fikerte Shate, and I work in Paulos Hospital's post-abortion room. A year ago, I was trained by EngenderHealth to offer long-acting family planning methods. The theoretical training lasted 4 days, followed by outreach and practical trainings in rural towns. Before this, it was very difficult for women in these areas to get the services due to shortages of both skilled manpower and materials. Now the number of skilled providers is increasing, so we'll see significant changes in the near future. Sister Fikirta is talking about the positive changes that are possible now that more nurses and doctors are able to offer women high-quality services that meet their needs. Such services are further improved by having renovated health facilities in many places. After research demonstrated how great of an impact poor clinic infrastructure was having on both service provision as well as client interest in seeking care, at select facilities, EngenderHealth has supported renovations that have improved the conditions of client waiting areas and modernized waste disposal and other infection prevention practices. This brought a number of facilities into compliance with national standards and made the overall experience of visiting a family planning center a better one. At the same time, EngenderHealth is also working closely with communities to increase awareness of family planning and its benefits, and to gather women's and men's input identifying needed improvements in clinics. For example, at some sites, in addition to providing training and other essential inputs needed for the provision of high-quality services, EngenderHealth has been working to strengthen linkages between health facilities and the communities they serve by supporting clinic staff and managers to host clinic walkthroughs for local leaders. During these clinic walkthroughs or visits, community leaders are introduced to the new services that are available so that they're better positioned to inform their communities about the services and their benefits for the health of women and their families. In addition, EngenderHealth has been working with a number of local community-based organizations to train and support community health volunteers to lead dialogue sessions about family planning, including health timing and spacing of pregnancies. Designed to mix users and non-users of family planning together in small peer groups, these community dialogues provide an opportunity for women and men to discuss their perspectives and experiences related to family planning among their peers, and particularly to hear about long-acting and permanent methods from satisfied clients. Community volunteers also visit couples at home to share information and offer counseling and referrals to facilities where quality services are available.
My name is Tamru Mangistu. I am the head of the North Shoa Zone, Basona Warada Kiit Health Center. EngenderHealth works with us to improve our family planning and safe abortion services. We have a walkthrough program wherein we raise awareness of our health center's services to the people in the community. 2 community representatives were selected from each of the 5 kabalets we serve to visit our health centers and to learn about the services we offer. They then share the information in their respective communities, and that generated a good deal of interest. Our client flow has significantly increased. Just 1 month after the walkthrough, the average usage of injectables in each of our qabalés has increased from 52 to 75. IUDs from less than 1 to 8 and implants from 10 to 140.
These figures are 10 times higher than the average monthly caseload for the prior 6 months, an impressive increase. At facilities like the EngenderHealth Center, an increase in the number of clients seeking services and receiving a long-acting or permanent method of contraception has been directly linked to having strong ties to the community, an effective system of referrals by voluntary health community workers, as well as the increased capacity of health centers to meet clients' needs. My name is Hamlesab Merid. I work in Bole 1720 Health Center as a family planning service provider. I graduated from Gonder Health Science College and I've been working for the past 6 years. About a year ago, I received training from EngenderHealth on family planning, and this year I've received a training on safe abortion care. An important goal following an abortion is to offer the client family planning. So during counseling, we emphasize the importance of family planning for preventing unwanted pregnancies. After the EngenderHealth training, our client flow has increased significantly. Prior to the trainings, we had 10 clients a day. Now we see 20 to 30 clients a day. This is mainly due to the fact that we have been able to offer our clients good service. The satisfied clients then go to their communities and share their positive experience, which in turn promotes our services. These include satisfied clients like Tasfaye Bayene.
My name is Tasfaye Bayene. I am a farmer. For the past 9 years, I've been working as a family planning community worker. Since it's best to lead by example, I'm also a client of the permanent family planning services. I go to marketplaces, events that involve community gatherings, workplaces with large groups of people to discuss family planning services that are now available to our community. When I first started teaching family planning, we used to carry a luggage full of condoms and birth control pills to the villages. However, once we successfully got the word out about the family planning options, women and men started to come to us.
Improvements in access and quality of long-acting and permanent contraceptive services across Ethiopia are an opportunity to meet the rights and needs of millions of women and men. With our partners, EngenderHealth has made great strides in supporting the national government's effort to train providers and upgrade services, improve facilities, and work with the communities to help women and men better achieve their reproductive health intentions. But the needs are vast, and to fully meet them requires strong partnerships. The health sector has a pivotal role to play, and so too should development partners join hands, pool expertise and financial resources to help make a difference in the lives of individual women and men, and the health and wealth of communities, and ultimately a difference in the future of Ethiopia.